My name is Dr. K.K. Parashar, Principal, School of Nursing, Sanskriti University. So today we will discuss about the topic is KMC. KMC is Kangaroo Mother Care. So basically this concept is based on the animal which is found in Australia, kangaroo. So kangaroo have a sac in their lower belly, and in that sac the kangaroo use for keep their baby for the protection purpose and care purpose. So the same concept we will see. So the kangaroo mother care. So kangaroo mother care is a method of caring of a newborn infants. So this method is using for the newborn babies or the babies those who have a weight particularly less than 2000 gram, and in this method the infant is placed between the mother's breast is direct skin to skin contact. So keep in your mind this baby should be kept on mother's chest. Okay, these all are the components of KMC. So for the KMC, we need a first component is skin to skin contact. In that, the baby should kept mother's breast for the skin to skin contact, as you can see in this view. So in that baby should be kept for the prolonged period with mother's contact. So the baby will get a temperature, baby will get a heat from the mother side. Then next is exclusive breastfeeding. If baby will be on a prolonged period on mother's breast, so it promotes the lactation and facilitate the feedings. Next component is physical, emotional and educational support. For this type of a mother, we provide a physical support from the family members. Like the mother should not be engage in other activities and provide a emotional support. This method provides the emotional support, as well as this method create a bonding between the mother and baby. For this method, we should educate the mother. To give this method, and we should educate regarding the proper positioning and how to care of a baby with this method. Next is benefits of KMC. There are certain benefits of KMC. The first benefit says it promotes the breastfeeding. So it's generally promoted by the government also, early initiation of the breastfeeding, or give the breastfeeding all, because mother milk is a milk which is necessary for the child for the growth and development of the baby. So breast milk is important, and through KMC we can give a breastfeed. So increase the breastfeeding rates or increase the duration of breastfeeding. So baby is on a prolonged time on a mother's breast, so it's increase the duration as well. Next is thermal control. By these methods, the thermal control is because after birth baby is lose the weight. In early phase, baby is start to lose the weight, lose the temperature. Why baby lose the temperature? Because baby after extra uterine life, baby is not habitual in this outer the surroundings or extra uterine life. So baby start to lose the temperature. Another reason of this baby is start to lose the temperature is, next is benefits of KMC. Breastfeeding, the first benefit is the breastfeeding. So this KMC, Kangaroo Mother Care, increase the breastfeeding rate, because baby will be on a prolonged period on mother's breast, so it will enhance the breastfeeding and increase the duration of breastfeeding. Obviously, the baby will be on mother breast, it will increase the duration of a breastfeeding. Then thermal control. Effective thermal control, because baby will be a skin to skin contact of a mother, so mother baby will be receive the mother's temperature and baby will not lose the temperature. You can see in this pic, baby is getting a temperature by the mother through the skin to skin contact, and it says this is it's equivalent to the conventional incubator care. There are some other benefits of KMC. KMC satisfied all five senses of the mothers: touch, hearing, taste, vision, olfactions. So through KMC, Kangaroo Mother Care, basically the mother can touch the baby, mother can feel the baby, mother can smell the baby. That's why they are saying it's satisfying the five senses of the mother. And here this rule is also applicable for the baby. So by this rule we can say it's create the bonding between mother and child. And next is increase in weight. Definitely, if mother and baby will be together, and baby is getting a proper nutrition through the breastfeeding, so and baby is not having any diseases or not losing a temperature through this method, so baby will increase the weight or less stress to the parents. So it's correct that the parents will not be in a stressful situations, while the baby they have a all the time the baby and in their eyes. So we can say the less stress to the parents. The eligibility criteria for baby. The eligibility means that what type of a baby is eligible for receiving this type of a care. The first one is birth weight is less than 1800 grams. The first criteria is the birth weight is less than 1800 grams. Next is birth weight is 1200 to 17900 grams, and birth weight is less than 1200 grams. All babies are eligible for the receiving this Kangaroo Mother Cares, but the condition is the baby should be hemodynamically stable. The baby should be hemodynamically stable is must. Hemodynamically means baby's vital should be stables. Baby's heart rate should be stable. Baby's blood pressure should be stable. Next is we should know the eligibility criteria about the mother. Like first of all, we should know the willingness of the mothers. Mother's willingness is important. Next is general health and nutrition. Yes, general health of the mother is important. Mother should be free from any skin diseases, or mother should not have any kind of a respiratory or any type of communicable diseases. Mother should be general health good, and nutritional status also mother's good. Next, hygiene. Mothers should keep her maintain her hygiene and also support the family. Yeah, in this method, the support of the family is must from his grandparents or parents. The support is must. Like if mother is engaged in this KMC, so we should not disturb the mother to do another work. Mother should be free for the process. Next is preparing for KMC. Preparation of a KMC, the first point is counseling. In that, the proper counseling is important. In that, demonstrate a procedure. To whom we will demonstrate? Who is willing for giving this KMC? Like if mother is willing to give the KMC, we should demonstrate the procedure. How to hold the baby, how to carry the baby, how to keep the baby on breast, and how to hold the baby, and a duration also to demonstrate the mother. Next, ensure the family support. Yes, we should ensure the family support, like a mother's father, husband also should provide a proper support to the mother to do this procedure. Next is KMC support group. We should introduce this type of mother to other mothers who are giving this KMC to the baby. So KMC support is important, so mother can learn another things from other mothers also. Mothers are clothing. So what kind of a clothing is recommended? This type of a mothers. In that, the first point is front open light dress as per as the local culture. First, the dress is important. The dress should be open from, because we should provide a skin contact, so the front area should be open, mother side. And for the babies, it's recommended to provide a cap, socks, nappy, and front open sleeves shirts, like jabla type of cloth is recommended to give the KMC to the baby. Next is, you can see some positions to provide this KMC, like this is one position you can see, and if mother is on bed, you can see this picture to provide the KMC. In this picture, you can clearly see the baby is on mother's breast, and both are in a sleeping conditions, and you can see the baby is fully covered, having cap and all. See the picture. Both are in a satisfied. Okay. Next, monitoring during KMC. What are the things we should check out during the time of KMC? First is neck position is neutral. Neck position is neutral of the baby. Then check the airway of the baby. Check the airway. The baby airway should be clean. Check the breathing is regular. Check the baby is taking breath by normal way, or baby is not, there should not be any obstacle. Check the colors of the baby. There should not be any sign of cyanosis of the baby's body. And next is check the temperature is being maintained by these procedures. Okay, next is initiation of KMC. So baby should be stable. The baby should be stable. Hemodynamically, baby should be stable. Means vitals of the baby should be stable. Heart, blood pressure, pulse, and all. Heart rate and all. Next is short KMC sessions can be initiated even if the baby is receiving IV fluid, baby on parental therapy, baby is on oxygen therapy, or baby is on NG tube feedings, orogastric feeding. Baby is receiving all these. So this type of babies, we can provide a short KMC if it is recommended by the physicians. Duration of the KMC, in that the duration, start the KMC session in the nursery. So nursery where we keep the babies, there we can start the KMC. Then practice 1 hour session initially. 1 hour session is initially 1 hour we can give the KMC. Then transition from conversation care to longer KMC. Slowly after 1 hour we can keep it as a long period time. Then transfer the baby to postnatal ward and continue KMC. First they are starting this KMC from the nursery, then they are transferring the baby to the postnatal ward where this KMC is continued. Then increase the baby's this procedure up to 24 hours. Next is initiation of KMC. Next, continue. Baby should be a stable, and short KMC is session can be initiated even if the baby is, sorry, this. Any family member can do it. So who is eligible? Who can do this KMC? So any family member who is willing to do this KMC, he or she can provide the KMC. As you can see, the male also provide this Kangaroo Mother Care, but we will use another word, Kangaroo Father Care. Here, the one objective of this KMC will not be fulfilled. That is a nutrition. Criteria for transfer, in that for nursery to ward, the baby should be stable. From the nursery we start to KMC, so the transfer criteria, the baby should be stable. Then gaining a weight, baby's weight should be, the weight should be gained by the babies. Next, mother confident to looking after the baby. Mother is more confident, she don't want further guidance, so we can say the mother is confident of looking after the baby for the transfer criteria to the ward. Discharge criteria. So what is the discharge criteria? Baby is well with no evidence of infection. Now we are planning for the discharge of the baby. So the first criteria is baby do not have any kind of infections. Second criteria is feeding well. Baby is feeding very well mannered from the mother's breast. Next is gaining a weight. Babies have gained a weight 15 to 20 gram per kg per day. Then maintaining body temperature. Then mother's confident to taking a care of the baby, and ensure that mother is ready for the follow-up visits. This much should be ensured. So this is all about the topic is KMC. Thank you.